When we last spoke, you were telling me you were thinking Duke or Florida State. Have you narrowed it down?
I have not. Now I think my options have even gotten bigger. I'm thinking about, I don't know, maybe New York.
Any particular college or field of study? My kids hate when I ask that, but I got to do it too.
No, not yet. I'm keeping my options open.
Okay. Best of luck to you. Thank you for your time.
Thank you.
Mr. Henderson. We could pull up 101, 1001, 1930, please. Now, I am through these different notations they had you make on your, what was it called? The My Plan?
My Special Care Journal.
All right. They gave that to you.
Correct.
And they were pretty insistent that they wanted you to fill that out?
Yes, the nurse who gave it to me before, so I went to her and I was complaining that I haven't seen my mom and I haven't been able to talk to her, and she suggested that I write a note to my mom, so she came back with the Special Care Journal.
But at the same time that they were trying to get you to talk about them in a good light, you were telling them that you were in too much pain and you hate this hospital. Is that right?
Sustained.
That's very true. Oh, sorry, I'm sorry.
I'll rephrase.
Thank you.
At this same period of time, if you look down here to this note right next to the bottom, did the hospital document how you were truly feeling about them?
Yes.
All right, let's pull up then 100-0313. 1001-0313. Okay, this is from November 5th, and here you are telling them what? That you want to go home, and you did not want to participate in rec activities?
Your Honor, again, we object to leaving a clear question.
Sustained.
What, if anything, were you telling them about your desire to be there and to do this stuff?
Well, I know from experience that physical therapy that I've had in the past, like very intensive and not at my pace and tailored to my needs, actually ends up hurting me as well as my CRPS.
Let's pull up 1001-0510. That's 1001. Okay. And if we could scroll down. And what did you tell them, as documented in this note, about what your stay was like?
Could I have 1 second to read it first?
Yep.
Okay. This definitely accurately depicts my mindset at the time. You know, everything that I thought they were doing was hurting me, and even though I was telling them what the right course of action could be, they were not willing to listen and instead actually laughed at me. There is an instance where a doctor literally laughed in my face.
Well, while they were documenting you saying this in their records, did it appear almost like they had a plan to develop evidence that you really did secretly like them? What, if anything, did it appear they were trying?
I'm sustaining the objection.
What, if anything, did it appear to you they were trying to do with all of these notebooks and tell us what's good and tell us why you love it here so much?
You overruled on that one.
Well, I think it's important to note that with the My Special Care Journal, you all did not see the entirety of the journal. There's a page with saying like things I liked about the hospital, but there's also a page that depicts what I did not like about the hospital, and the page is full.
And along those lines, you had been to a lot of outpatient doctors, is that right?
Correct. Are you referring to the Johns Hopkins? Yes, yes, I have.
Mm-hmm. And so when you're referring to some of the doctors here, were you referring to those outpatient doctors that were trying to help you?
Yes, I believe so.
And were the outpatient doctors questioning your CRPS or accepting your CRPS?
They were generally very understanding of my CRPS.
And insofar as whether Father Tom was appropriate for you, did he make you comfortable or uncomfortable?
Initially, he made me comfortable. I confided in him, and I told him about my situation at Johns Hopkins All Children's Hospital and the way I was being treated and how I wanted to go home. Then he relayed to me that he had a very traumatic experience of his own. I don't know, he didn't give me a time frame, but he said in the past, and I come to find out it was something extremely inappropriate, which I don't know if I'm...
So did you want your priest that you regularly knew and trusted?
Yes, after finding out what he had done and the things he had, I definitely wanted my priest back.
Did they ever explain to you why they were going after your mom for this, for these medications instead of the doctors, licensed Florida doctors, experts in the area? Can I get the question out?
What's the legal basis?
Obviously,
Well, let's work on our pronoun usage. Let's eliminate pronouns.
did the Johns Hopkins doctors that you spoke to ever explain why they were going after your mom if they had a problem with your treatment as opposed to the doctors prescribing it?
Ms. Kowalski, you may answer the question.
Can you repeat the question one more time?
Sure. Did any of the doctors at the hospital ever explain to you why they were accusing your mom of these things if it indeed was all about the prescriptions and the treatments you were getting instead of the doctors, licensed Florida doctors that were prescribing it?
Same objection and argument.
Overruled, you can answer.
They never directly explained to me.
Does that complete your questioning?
Right, Judge, but we have a proper obviously.
Okay, so you're finished with redirect?
I am.
Any recross?
No, thank you, Your Honor.
And members of the jury? Okay, and Ms. Kowalski, I just want to remind you that you're still under oath.
Yes.
And so the jury is aware, since I didn't have the white noise machine on, we did ask Ms. Kowalski to step outside, so she did not hear the discussion I had with the lawyers. And I am able to ask almost all of them, but there's a few that I cannot ask. Okay, we're going to start. You stated documentation shows additional photos of Maya Kowalski were taken upon Maya's return from court, before and after photo documentation. Are you aware if there are any after photos in your medical records at Johns Hopkins All Children's Hospital?
To my knowledge, the photos weren't even entered into the medical records, so there's no proof of, as far as I'm concerned, of a second set of photos.
Did the jury hear correctly? The series of photos before court are not in your medical record. Please clarify.
Yes, so when I talked to Kathy Beatty, I asked for her to only put them into the medical records because it was my understanding that that was a secure place where only doctors can access that, as opposed to anyone who had access to the camera that they took the photos on. She told me that she had put them there, but as of last weekend, I figured out that that was not the case, and I was infuriated because she made it seem like she was entering them into the medical base.
The next question. During your stay at Johns Hopkins All Children's Hospital, you were at some time not able to view TV and only have a ticking wall clock was available to you. While you were at Johns Hopkins All Children's Hospital, did the staff inquire if they could assist you in any way, such as adjusting the TV channel, the volume, bringing an item closer or farther, adjust your bed? And this is excluding the 48-hour period.
Gotcha. So this was during the PICU where I wasn't allowed, well, I didn't have access to the TV. So I really just sat there and watched the clock, and it was extremely depressing. I did have the call button, but for a nurse to not even want to assist me to use the restroom, it was highly doubtful that she would go out of her way to turn on the TV. She was very aggressive with her answers about me using the restroom, and most of the time she declined. Therefore, I didn't want to waste my request on pleasure activities like watching TV versus necessities like using the bathroom.
When it comes to, quote, creature comforts, end quote, were you made to feel comfortable, or were you made to or just felt that you were in a hostile place?
The creature, is that about the stuffed animals, I would assume?
I'm assuming it would include stuffed animals, but any sort of creature comforts that would make you feel comfortable.
Okay, so there was a point where my dad was able to bring some of my stuffed animals at home, and those did provide me comfort, but obviously I would prefer my family there.
As hospitals may, and this is if you know, as hospitals may and do use both colors and even symbols to identify patient conditions and status treatments and restrictions, are you aware of any photos that may reveal these placards on your room?
So my dad, I don't believe, was allowed to take photos of things outside of the room because of, it might have been a HIPAA violation to other patients in adjacent rooms. It was just standard protocol, I guess. But again, I did see the name tags of other patients there, and they looked very different. So they had stickers on theirs, but it was like stickers of princesses or trucks, but mine were circular, solid-colored stickers. And again, I asked what they meant, and they wouldn't tell me.
The next question from the jury. You stated Dr. Kornberg recommended first boots to straighten feet, and if that failed, then surgically breaking and setting your feet straight. First, on that line, you said the boots were tried but failed. Is that correct?
Yes, because the dystonia only advanced. As there was more agitation of the nerves, it just got worse.
Okay. Did your dad, Jack Kowalski, or your mom, Beata Kowalski, or you agree to boots?
We did agree to trying the boots. Even I agreed at the time because I did not know I had CRPS and I didn't know that it would ultimately hurt me. They were painful, but I wasn't against trying it.
It seems the surgical remedy was not done. Do you know why the surgery was not done?
I know my parents immediately, when that statement left Dr. Kornberg's mouth, they objected to that. They didn't think that was the right course of action, and they wanted to wait.
And the balance of the questions I cannot ask. Okay, the next sheet. I'm not asking Ms. Kowalski these questions, but members of the jury, there's been another request about dates relative to the court orders, and I will, in the future, get that to you, I promise. Okay, the next series of questions. How long did Dr. Kirkpatrick spend with you before issuing the CRPS diagnosis?
It was multiple hours, and this stays true with all of the doctors I've seen for a full examination of CRPS. I would argue it was about, I know it was, most of them, it was around the range of like 5 full hours. And not only did they just do the examination, but they also spoke to my parents about the symptoms and me individually as a patient.
Was this the same day, i.e. the date he issued the CRPS diagnosis, was this the same day that you met him?
I believe so, yes.
You said that ketamine was effective. It must have been a relief to experience some relief. Did you find that as the effects wore off, that the contrast made it more painful?
That's a good question. I think I was so used to pain at that point, and I was so used to it coming back that I didn't really notice, like, I don't think the contrast itself made it worse because I've experienced the contrast pain before as well, if that makes sense. So I was familiar with the pain. I don't think the contrast itself made it worse. I think it was just whether there was a trigger involved that made my CRPS worse, or if it was just a matter of the drug not working as long as we would have liked it to.
You mentioned in your testimony that you had open dialogue about treatment in that your parents did not pressure you. Can you describe a treatment you discussed? How did you articulate that as a child, and what specifically did you turn down?
So this would align more with the whole Mexico treatment situation. The doctor spoke to my parents first about whether they were considering that as an option. And then the doctor spoke with me individually to just check and see how I felt after explaining all the risks. Obviously, he dumbed it down a little bit to a level a 10-year-old could understand, so I can make an informed decision. And again, because of the pain, with it being so terrible, I decided to go forth with it, and my parents listened to me and ultimately decided to make the trip.
Okay. Dr. Cantu mentioned that even touching a CRPS patient could result in lesions. Has that happened for you at all?
So every CRPS patient is different. For me personally, my CRPS wasn't a thing for me. It's something I haven't noticed. I did have lesions, but they didn't sprout from just a touch.
Okay. Now, the next question in that series I cannot ask, but the following question is, please elaborate how you overheard the nurse speaking to your mom. Where were you standing? Why were you there? And how did you know it was your parent?
So I learned about that conversation. I wasn't actually near the nurse or I actually don't even know who it was, but I know it was somebody at the hospital because my mom had called the hospital itself. I learned about the conversation through an audio that I listened to.
Describe how opioids make you feel.
I honestly don't really remember the feeling of like opioids. I know I took them initially early on, but they didn't do anything for my pain at the time. I didn't notice, there's nothing notable about them that I could pick out and tell you, and I apologize. It was a really long time ago. But I know that the ketamine worked, and I know the opioids didn't.
Next question is, are you Catholic?
Yes, so it's a little interesting. So I grew up Catholic, and after my mom passed, I became a little less religious just because I didn't really understand how God could take someone from my life so important, but eventually I came back to my faith, and I understand that was just part of my grieving process.
Do you carry a rosary?
I have one in my pocket.
When was your last Mass?
I actually haven't gone to church in a while, and I'll explain that. I used to go to Epiphany Cathedral. It's in Venice, and the four of us have gone as a family, my mom, Kyle, my dad, and I. We did go back multiple times after her passing, but it's just very difficult because you get looks from people, and they know that your mom's not there, and it just doesn't feel right without her. There's a lot of activities like that, and that's part of the reason I stopped skating as well.
When is your last confession and communion?
Last communion, that was more recent. I don't have the date on that, but someone came to my house, and this is kind of weird, but my grandma, she's very Catholic. She lives in Illinois. She'll send me communion through the mail from her church, and it's blessed and whatnot, and I'll take that. Confession, I have not had confession in a minute, and again, that's because it's at the same church I used to go to with my mom.
The next page of questions, I'm only going to be able to ask 2 of the 4 on this one. The question, relevance to Lent. Did the chapel shown have a tabernacle? Did you ever see the Eucharist?
So there was at one point where I was given the Eucharist. It was that's when I was talking about the body. Like, it was a month after the priest had come and visit me, but I didn't see a place in the chapel. I don't know how to say that, but wait, the big word that you just said, it was not in that chapel, no.
How did you become aware of diagnosis after your mom passed?
Diagnosis of...
I'm just reading the question.
Yeah, you're good. Trying to think of what diagnosis that could be in reference to.
Did you find out a diagnosis as a patient while you were as a patient?
Oh, okay, I see. Okay, I got it. So it was only after I had left the hospital that I was able to review the medical records, and that's when I saw the conversion disorder and fictitious disorder. When I was in the hospital, I just had to assume that's what... I didn't know the technical term because I've never heard of such a thing before, but the way that they were treating me, I knew that they thought I was making it up. So I knew whatever they thought was going on, it was a disorder in which I was making it up. And then when I reviewed the medical records, I was finally able to attach a name to what they were thinking.
Okay. The next question is a clarification. In 2020, when you had that relapse and you were in the hospital for approximately 1 week, were you at Johns Hopkins All Children's Hospital?
No, I believe the name of the hospital is Arnold Palmer in Orlando.
Okay. Was another port installed, or was there already a prior port?
So there was no port. I just had the nose tube.
Did Kathy Beatty console you when your mom passed?
She did not touch me or anything. She just said she was sorry, and she said she had another patient to see and left the room. That was probably the only time I saw her not really wanting to stay in the room.
Given the answer, I'm not going to ask the balance of that question. Okay, the last question from the jury. Do you know if you discontinued use of opioids that you were prescribed the times of alternative treatments, such as the ketamine treatment in Mexico or the hyperbaric chambers, etc.?
Yeah, I think there was some testimony about after CAN2, there was no need for any opioids because the treatment had worked so well that my doctors at home who were comfortable prescribing them, they decided to stop prescribing them because of my progress.
Okay. Mr. Anderson, any follow-up?
Take it then that Ms. Beatty actually did not stay to try to console you and make you feel better about this.
Same objection, Your Honor.
Overruled. You can answer.
Can you just, I'm sorry, one more time?
Kathy Beatty did not hang around to console you, make you feel better. She just said, "I'm sorry," and left.
Yes.
You were asked about creature comforts, and I think you were talking about your dad bringing you stuffed animals. The question might have been, did the hospital give you creature comforts, make you feel comfortable?
I do not recall. I know I did arts and crafts and such, but nothing, I don't know. They did not give me any stuffed animals or anything like that. Those were all from home.
And then there was a question about the surgery to break your legs. Have you learned enough now about CRPS to know whether going in with someone who has CRPS, breaking their legs, then trying to pin them back would have any beneficial effect?
That would not be beneficial whatsoever, no.
Let's see. And as to Dr. Kirkpatrick now, did he follow you for several weeks, months after the first visit?
I believe we kept in touch with him, yes.
All right. And did he continue to keep up with how your symptoms were doing? In other words, was it helping or not?
Yeah, the improvements, especially after Mexico. He was one of the first people to know.
Well, I think the jurors are wondering, did Dr. Kirkpatrick continue to mentally challenge the CRPS diagnosis such that, you know, if things didn't clear up or got worse, maybe it wasn't CRPS?
Object to the leading order.
Sustained.
Was Dr. Kirkpatrick sure it was CRPS, and why?
He was sure it was CRPS because of his in-depth examination, his observations, and the symptoms that aligned. I mean, there were so many questions I had to answer, and then he also questioned my parents. And he's seen a bunch of patients before, both pediatric and adult, so he was really good at identifying that. His whole place is a research institution as well, so he really understands CRPS.
Thank you.
Mm-hmm.
Defense, any follow-up? Oh, sorry.
There's some confusion on the timing of the port, for the infusion port. And I ask it in a strange order, because I was asking it with the Arnold Palmer. Just reminded me. In any event, was the port that you were testifying to that was involved with the infusions of the ketamine in the spring of 2016, as opposed to, you know, well after at Arnold Palmer?
The port was placed after Kirkpatrick, after Cantu, but before Hannah, or around the time of Dr. Hannah.
And it was to facilitate the ketamine infusions?
Yeah.
Overruled, you can answer.
Yes, and that's what we told the doctors at Johns Hopkins All Children's Hospital, and they installed it.
Now, are we finished?
I believe so.
Defense, anything further?
Briefly, Your Honor. Just on the photos, there's the two sets that you were asked about. Again, do you know, if you recall, whether one was taken before you went to court and one was taken after?
Objection. Asked and answered, and proper predicate.
Okay. Overruled, you can answer it.
Again, to my recollection, it was just one set of photos. I really don't remember the second set being taken.
Okay. You were asked about when you learned about certain diagnoses. Do you remember whether your parents shared with you what the diagnosis was coming from Lurie Children's Hospital?
I know that they recommended me for intensive PT, and that's what we did. I had heard that other doctors in the past have thought that it may be in my head, but they never confirmed the diagnosis.
Okay, and I guess that's the reason I'm asking you. I'm sure, you've had a lot of growing up to do throughout this trial, talk with Mr. Anderson. I don't want to know about that. But back then in 2015, were you told about what all of the diagnoses were coming out of Lurie Children's? Did your parents tell you that?
Again, I knew as much as I did. I knew that they weren't entirely sure, and I know that they may have believed that there was a psychiatric component. However, there wasn't.
How about from Tampa General, when you left Tampa General in around August, end of August 2015, did you know either from the doctors or from your parents what their diagnoses were?
I know Bonnie Rice, the nurse, she suspected conversion disorder.
Okay. And just last couple questions. Do you recall that there was so your bed in the pediatric ICU, we use the word PICU, but PICU, your bed in the pediatric ICU had a call light with a remote control to your TV, right?
I know of the call light, yes.
Okay. It also contained a remote control for you to watch TV.
I believe those were separate.
Okay. You had access to a TV in the pediatric ICU.
There was a TV, yes.
Okay. And there was a TV that you could access with remote control in the EEG monitoring room?
I'm having a hard time remembering that one, but I know about the PICU.
Okay. If I represented to you that you had a TV with a remote control in the EEG room, would you have any reason to dispute it?
Well, I know that there were TVs in the rooms, but it just depends on how far away the remote was from my bed.
Okay. Do you remember that the remote control to the TV was with the same paddle as the call light?
I remember on floor 7, yes.
Okay. And whether it was the same in the EEG room, you don't remember one way or the other?
I don't.
Okay. I appreciate your time.
Members of the jury, do you have any further follow-up questions? So we're finished with questioning. Okay, members of the jury, I think this is going to be a good time for us to call it a day. Thank you. The jury's out of our presence. Everyone, please be seated. My understanding, Mr. Anderson, you wanted to do a proffer?
That is correct.
Okay, so the court reporter should just mark the transcript that this is the beginning of a proffer.
Please, court. Maya, do you recall a time at Johns Hopkins Hospital when a doctor came in and made you feel uncomfortable?
Yes, I do.
And approximately how far into your stay did this happen?
To my understanding, it was fairly early on. I want to say October. So it was in the beginning-ish.
And you've subsequently seen a note by Dr. Katzenstein, the psychologist there, that documented it, meaning it had to happen before that.
Correct. I confided on her a few days after about the incident that occurred at Johns Hopkins All Children's Hospital.
All right. And the record reflects that was October 17th or 18th. So now, tell us what happened on that day, beginning with approximately what time of the day was it?
I want to say it was a little bit after the morning because typically I had PT in the morning. I don't remember if I had PT during this time, but I know that it was light outside regardless. And this doctor, he opened up the door, and typically with a doctor, there's either nurses. He walked in alone, which struck me as odd, but I didn't question it at the time.
You were 10.
Exactly. I didn't really know how it's supposed to go. I've been to hospitals before, but I just assumed maybe this is normal.
What happened?
He shut the door. Then he came over to the left side of my bed, and he bent down a little bit and asked if he could take a peek. I did not answer him because I was waiting for further elaboration, so I paused, I didn't say anything, hoping that he would get the idea, tell me more. Instead, he removed my covers, he pulled down my pants, he looked at my private area, then he proceeded to pull up my pants, and he then quickly said, "Thank you," left the room.
So there was no chaperone?
There was no chaperone, no. I know that for certain.
And he physically touched you as he was pulling down your pants and then underwear?
Correct, because I could not do that by myself.
And the amount of time he spent staring or looking at your private parts Was it longer than what a doctor you would normally think if someone was to do that?
Sorry, Your Honor, I apologize. I object to the leading and the speculation.
Overruled.
Well, I've never had anything like that happen to me before, so it was unusual, like, period, especially because he did not ask for my consent. After he left the room, I just hysterically started crying. I had no one to tell. I had no phone calls with my mom. I didn't really feel comfortable telling my dad in the presence of my brother. So I told that doctor.
All right. And can you describe who it was? Strike it. At this age, you had yet to reach puberty, right?
Correct.
So you had never had an exam down there.
No, never.
So did you have any idea what he was doing?
No, I was very confused, and I was confused on why I was feeling so uncomfortable about it, because I've never heard of something like that happening, and honestly, I was like ashamed because I didn't think it was, I felt like I shouldn't be complaining or I shouldn't be feeling this certain way. It wasn't that big of a deal. But the fact that it made me feel that way and the fact that I still think about it to this day shows that it was a big deal.
Describe what the man looked like.
To my from my recollection, I remember the man having tan pants on.
What, did he have a lab coat on, or?
I don't remember their. Let me think about that. Hold on. I don't want to say yes or no to that because I really don't remember about that specific detail. But I remember he was really like skinny, and he was taller than me, and I was 10, but he was tall to me, and he had glasses and like dirty blonde to brown hair in that range, and he was white.
What made you think he was a doctor?
He had that stethoscope.
Stethoscope on his
And
neck?
he had like a little clip that the doctors all had, but I did not read his name because I didn't think that event was going to be significant.
And after you told Dr. Katzenstein, did you tell anyone else up until, say, 2022 and Dr. Henschke?
I had told my ex-boyfriend in 7th grade, and I started crying. But because I told that doctor at Johns Hopkins All Children's Hospital and nothing was done, I was kind of made to believe that it didn't matter what I went through. So my ex-boyfriend was like the first person I told after that, and he knew it wasn't okay. And that's when I finally had an understanding of, that was not right. That's not acceptable whatsoever.
And marked into evidence adjoining exhibit 1001-3817, if we can bring that up, but I can read it in the interim. She denied history. This is Dr. Katzenstein's psychological progress note, and this is dated, I'm looking at where they put this. I think it was the 17th, but let me look. Yes, October 17th. And there at the bottom, do you see the what was put down by the psychologist?
Yes.
Now, was there ever any follow-up by anyone at Johns Hopkins when you said previously a doctor had looked at her private parts but did not touch her and it made her feel uncomfortable? Did anybody follow up to ask you more about this?
No.
And since that time, what happened with your memory of this?
I mean, I've remembered it throughout the entire time. It's not like it, just disappeared. I just have chosen not to speak up about it because, again, I thought it was silly that I felt that way because when I told somebody and nothing was done about it, it made me feel that it wasn't significant. It wasn't a big deal.
And without waiving any attorney-client privilege, then it was only about 10 days to 2 weeks ago the first time you told me.
Again, yeah, it's because I didn't think it was a big deal because they made it out to not be one.
Okay.
And they, I mean, the hospital. That's, I should clarify.
And so did you feel embarrassed by?
I was. I don't know why. I just, like, even talking about it, it's just so personal and weird. So.
But you did eventually tell Dr. Henschke.
I did. I gained her, like, she gained my trust, and I told her.
Your witness.
Oh, I don't have any questions, thank you.
And you recall, Maya, that we had you on here before, but we had separated out to have you talk about some of the human damages at this point. And I wanted to go into 3 and really 4 different areas involving your physical and emotional pain and suffering, mental anguish, and the loss of capacity to enjoy life. And then I would like to go into a little bit about the loss of your mom on the wrongful death claim. So I want to start out on physical and emotional pain and suffering and ask you how what has happened here has affected you, and do you believe that you do need medical or psychological treatment from time to time?
Most definitely, yes.
And so are there problems about this that you can explain to the jury?
Yes, so I still experience CRPS pain, and unfortunately I am a little bit scared to seek treatment because of what happened last time, how I ended up at Johns Hopkins. I'm also a little bit afraid to even talk about my pain, 1, because I don't want to worry my dad, and 2, because I don't want people to tell me that I'm faking it.
Is it hard for you to describe symptoms?
It's not hard for me to describe symptoms. It's more so that I'm afraid that they won't be believed.
Is that difficult for you when, for so long, your statements, your pleas, if you will, about your pain were disregarded, or you were told that they weren't real?
Object to the leading, Your Honor.
Overruled.
Yes, and I still suffer from that to this day.
To this day, do you still have any feelings inside where you question yourself if there is an injury or emotional issue?
Yeah, so I told the story a little bit about how I broke my pinky playing football, and I waited a couple of days before I actually went and got help for it. I thought maybe it will go away. I'm just being dramatic, and I kid you not, my pinky was completely to the side. And I actually only sought treatment after my aunt, because she worked at the surgery center, that I went to get it fixed. I was only comfortable knowing that she was in the operating room with me.
Now, the jury would like to know, though, they know that you've seen like a dermatologist, and you've been to the dentist, I think?
Correct.
Right. So why are you able, and you were actually admitted into a hospital up at Arnold Palmer, I think, for one of your relapses, were you not?
Yes, I was. So with Arnold Palmer, the first thing that we did was talk to my primary care physician, John Wasner. And when he talked to the hospital individually, that's when I felt comfortable going to the hospital and staying there. If you talk to the doctors, they would tell you that I definitely wanted to get out. I stayed there for a week, and then we continued the rest of the treatment at home. Sorry, what was the first part of that question? I completely forgot.
It was about whether with physical, and well, first about the dermatologist and the dentist. You've been to those.
Yes, so, I mean, I haven't really been wronged before by a dermatologist or a dentist. Those appointments typically last about an hour, so I feel more comfortable going there.
And also, from your perspective, does it seem likely that your dermatologist or your dentist will try to have you taken away?
Yeah, I don't think like a dentist would ever do that, and I've never heard of such a thing.
So how are you sleeping now? Understand you recently discovered melatonin, but
Yeah, so I'm not sleeping that great. There's 2 sides to it. So it's either I stay up all night,
I am in pain and I'm thinking about all of this, the legal stuff and Johns Hopkins All Children's Hospital memories, or I fall asleep and I have nightmares and I wake up sweating. Sometimes I cry because whenever I dream, it's not dreams, it's more nightmares and remembering all the trauma.
Okay. So how many hours do you sleep on average a night?
5.
What happens? Have you tried tramadol? Any of those?
I
Any
have
of them?
trazodone, yes, and
Trazodone?
I mean, again, I'm able to fall asleep, but then once I enter REM sleep, I start dreaming, and it's just too difficult.
Does it wake you up even with the trazodone?
Yes.
And so now, Maya, they know, everyone knows that you're a very, very good student, but can you tell the jury about any difficulties that this emotional pain and suffering, physical as well, to the extent it's been aggravated, has changed your ability to focus, study?
Yes, so when I'm experiencing higher levels of pain, it's harder for me to concentrate on the material. And then with my mind just thinking about Johns Hopkins all the time, because I haven't been able to get proper therapy, I could be reading a paper, I could get to the bottom of the page, and I have not absorbed a single thing, and I have to reread it like 3 times before I actually remember it.
That adds to the time you need to absorb material in school and so forth?
Yeah, it takes me a significant amount of time. Even though I'm smart, it's very difficult.
And how does it affect your pleasure reading? Or do you do pleasure reading, I guess?
Yeah, no, I don't even read anymore. I would like to, because I do enjoy reading. I like learning.
Okay. Now, have you found any difficulty with talking about, strike that, have you kept up with some of your friends, people that you knew or know who have or had CRPS?
Well, I did have one friend with CRPS, but she did pass away from it a year after my mom passed away.
Your Honor, again, we raised the objection about discussing other people's medical care.
I'm going to overrule that.
But that's, yeah. Thank you, Judge. So,
And we also object on relevance, Your Honor.
Overrule the relevance.
so what effect then, and how are you doing right now, by the way, in terms of pain and symptoms?
I've had CRPS, since I got diagnosed with it, and it does fluctuate. I go through periods of time where it's better, and then other times where it's worse. I think just with everything going on, it has been a little bit harder to cope with. The last week in particular has been a little bit more taxing than usual, and it's hard to make it through the day.
As you sit here right now, though, because the jury's seen you in here, how would you rank your pain on a 1 to 10 scale as you sit here right now?
Right now, I would say that it's probably a 7 or 8.
But you don't grimace, you don't?
No.
Okay. So now, in terms of symptoms, do you have any symptoms right now other than the pain?
Other than the pain, I have lesions and there's slight discoloration in my right leg exclusively.
Is that where it started? Is that where the CRPS originated?
Correct.
Okay.
Yes.
All right.
And I'm still getting those monoclonic jerks.
Okay. Can you describe a little bit more for the jury what those involve?
So with the monoclonic jerks, it's completely involuntary. It could be from my foot to the top of my head. It's not a specific area that I just twitch in. So it's not really dependent on anything. It could be anywhere.
All right. So now, does this interfere with any aspects of your life? Strike that. Did this start? Strike that. When did this start? The monoclonic jerking.
I noticed it after Johns Hopkins All Children's Hospital, and it's just progressively gotten worse. And I did meet with my CRPS physician, Dr. Kirkpatrick, and he said that it's likely to get worse and worse.
Approach on this, please.
You may continue, Mr. Anderson.
what I wanted to get at was when you have the CRPS pain or these lesions starting up, how frank are you with your family about them?
I don't want to worry my dad. I mean, he has enough on his plate. He's a single parent, and I mean, just being the father of 2 kids is hard enough. I mean, it would be even harder if one kid was really sick.
I know. Okay. So, does Kyle worry about you too?
He does, and actually about when I broke my pinky, that was the last time he let me play football with him because he was so unbelievably scared that if I got hurt again, it would increase the chances of me being separated from my family.
Mm-hmm. And so these aggravated symptoms, and can you tell the jury, have your symptoms been aggravated by your stay at Johns Hopkins, as they've heard here?
I believe so. With the testimonies of the doctors, they relayed that when you interrupt treatment, it does increase the risk of it coming back.
Your Honor, we object. It's outside the foundation.
Overruled.
Yeah, I was done anyway.
All right. And then the circumstances you're in right now, ketamine worked for you before, but can you tell the jury why, over this period of time since you got out of Johns Hopkins, and let's leave aside any legal, but just emotionally and from your own internal sources, why don't and haven't you used the ketamine?
Well, besides the legal aspect of it, because I'm sure I can't get into that, but I mean, the stigma of ketamine in the medical industry for people who aren't familiar with CRPS has deterred me from seeking help again.
And does it cause you any worry that the wrong statement about it, the wrong request about it might cause this to happen?
Oh, for sure, yeah.
All right, so with the increased stress you've been talking about, has that had any physical manifestations? I mean, obviously the CRPS, but leaving aside the CRPS, and we'll get into the psychological, but leaving aside the CRPS, do you have any physical manifestations when you get stress?
Yeah, so the insomnia, and then another thing is I do have atopic dermatitis. It was pretty well managed for the most part with ointments. It was never really bad, but I want to say within the last year, it got to be a serious problem. My skin was just disgusting, so I went to the dermatologist for that reason. Now I'm on a shot called Dupixent, and it's completely gone, but those shots are, expensive, and I have to take them every 2 weeks to keep my atopic dermatitis under control. And I just want to say the dermatologist said that it wasn't from environmental factors, it was from stress.
Sustained.
So then, plus, needles, right?
Yeah.
All right, I want to turn to the mental anguish segment of these damages. You talked a little bit about the sleeplessness, but I need to know, the jury needs to know more about the anxiety that you feel and what it's caused you in terms of the mental, anguish, the mental pain.
I am quite fearful to even talk to anybody about my feelings. I don't know if I'm allowed to tell why, or because it's about the legal stuff, how it's been subpoenaed.
Let's stay away from
okay.
right
but
now.
I'm afraid to talk about that because, but then in the past at Johns Hopkins All Children's Hospital, I met with Dr. Lewis, who conducted a neuropsych exam, and he wrote down things that I did not say. So now whenever I go to a mental health professional, I'm scared that what their notes are actually not true with what I'm saying.
Has it been hard for you to establish a bond with physicians and therapists?
Certainly, it's scary.
Well, what about Dr. Henschke? Did she help?
She did. I really liked her, but it did take me a few sessions to warm up to her. But I would like to see her in the future if at all possible.
And do you have any fears that whatever you put in records may end up in one of these places?
Your Honor, we object move to strike.
Sustained.
So tell me also about going into a medical facility. Have you had any experiences lately that you can tell us about where you've had to go in?
I know, well, with the Arnold Palmer experience, there was like extra precautions that we took not only as a family, but we informed our physician. So every single time I go to a doctor's office or a hospital, it's quite frightening. There was actually one time I had a pretty bad cold, so I went to urgent care. But again, I waited like 4 days. And when I went into the examination room, it's like standard that you listen to the heartbeat. He asked me, "Why is your heart going so fast?" And it's even scary to talk about, but I just told him I have anxiety when coming into,
I'm going to overrule on that one.
but I just have anxiety going into those places.
Okay. Now, and we'll get into the activities in the next section, but kind of dumb question. How often do you think about your mom?
I think about her every single day. I mean, there's reminders all around. Anyone with blonde hair, I think of my mom. Anyone with glasses, I think of my mom. Certain colors she liked. Like Kyle said, perfumes. When I am at the mall and I walk by Victoria's Secret, I think of her because she loved going in there. Or like Telbots. I don't know, I see her everywhere, and it's a blessing, but also a curse. It's nice to be reminded of her, but it's hard.
And have you seen photographs of your mother when she was your age?
I did, yeah.
Does she look a lot like you?
Mm-hmm.
So have you had any concerns about, as you grow older, looking in the mirror and seeing?
Yeah, it's harder. I mean, everyone when I was younger told me that I looked just like her. And for some reason, I never saw it. But after she passed, every time I looked in the mirror, I myself was a reminder of my mom.
Mm-hmm. So then, you have chronic depression?
Yeah, it's pretty bad.
Okay. Now, is there any way the jury could differentiate between days when it's depression that's keeping you from doing the things you want versus days that the CRPS aggravation is keeping you from doing things you want to do?
I mean, the way to distinguish it would just be by asking. I don't think by looking at a person you could really tell what's contributing to the fact why they don't want to do anything. Mm-hmm. So with the CRPS pain, it's just if I'm hurting too bad that day or doing certain movements are too difficult and I can't go to the gym, I'll stay at home and I do just lay in bed. But then there's the depression, which is, I would say most of my depression would be revolving around my mom's death and then being taken away and being held at Johns Hopkins All Children's Hospital. And I constantly think about those 3.5 months.
Mm-hmm. Does it have any effect when you see someone that looks like Miss Beatty or some of those nurses?
Yeah, this is kind of embarrassing, but I did work as a server, and I was fine working there for most of it. I would say,
Barrel?
Yeah, Cracker Barrel.
How long did you work there, Carol?
Not long. It was a very short time.
Or months? Or?
It was maybe 2 months-ish, around there. It was a couple of months, but it was short compared to what most of my peers do. But I was serving this one table, and I was looking at my little notebook, and when I looked up to listen to her order, the lady looked one-to-one with Kathy Beatty, and I felt so bad, but I just stared at her, and I probably made her feel so bad, but I was so scared.
And so running into people that may look like some of the people that bothered you there,
Yeah,
how does that affect your desire to want to go out and do things?
it's hard because, I mean, I'm a teenager, so I like to go out with my friends, but at the same time, I avoid a lot of things, and I've never told anyone about what happened to me until, now it's pretty public, but, none of my friends knew, so they probably just thought I was weird or being, dramatic, but in reality, I just have really bad PTSD.
Yes. Teenage girls sometimes can be a little hard. So now, does it affect you in terms of wanting to go out and, well, just go out of the house? Or out of, I guess you have a boyfriend now and his
Yes.
house is nearby? How does that work?
So I go to his house a lot most of the time, and we used to go out downtown Sarasota, but there was actually another instance when we were walking past a restaurant, and there's a nice outdoor patio, and people were dancing to live music, and I could have sworn one of the people dancing was Kathy, and I completely panicked, and it's just so embarrassing because, if this continues to be a problem, I'm just afraid that people won't want to be around me or he'll break up with me.
And that probably makes you, if there's a decision to go out when you already don't feel so hot physically, does that add to it?
Oh, for sure, yeah.
Okay. And so would you say then, Maya, in this area, that before this, would you describe yourself as already being really quiet and kind of down, or did you have a different view or neutral view? What's the change?
Before, I was very optimistic and really positive. I was very outgoing and I love talking to people. But I think now it's just easier for me to be kind of neutral or negative about things, and then I don't get disappointed.
Mm-hmm. And do you have any flashbacks to certain incidents there where you are reliving them?
All the time. I mean, there's little things as well that people might think are silly but are so significant to me. Unscented hand sanitizer, I can't. I refuse. I will not put it on my hands. It just reminds me of John Hopkins, because all the doctors, before they come in, one of the first things they do before even saying hi is they clean their hands with the unscented hand sanitizer. My bed sheets at home, they used to be white, and I don't know if you've ever, stayed at a hospital, but the bed sheets are white, so I changed them to pink. Foods. So I remember almost every day I ordered the same thing because I'm a very picky eater and they didn't have a lot of options on the menu. So I don't really eat cereal anymore because that's what I had for breakfast. And then for lunch, I would always have a grilled cheese. I can't eat grilled cheeses anymore without getting sad. And then for dinner, I would have spaghetti noodles. And now when I go to restaurants, if I order spaghetti, I always have to get a different shape. That way I'm not reminded. And then certain colors. So Kathy Beatty always wore dark purple, and to this day, I refuse. I will not wear dark purple, and anyone wearing dark purple, I naturally tend to stay away from. And I swear I'm not trying to be mean. It's just, to me, it's protecting myself. And I don't know if you've noticed, but I only wear silver jewelry, and that's because Kathy Beatty exclusively wore gold. So it's almost like everything she did, I have to do the opposite.
Mm-hmm. It reminds me now, one of the jurors had a question after your last about, I think it was creature comforts.
Right.
Did you want to clarify that at all?
Yes, so I apologize. I didn't understand the definition of creature comforts. I assumed it was stuffed animals, but I've since learned what it meant. And no, when I was staying there, it definitely felt more so a hostile environment rather than a comforting one. There wasn't, much treatment for me. Even with brushing my hair, it was so bad that my Aunt Wendy had to cut some of it off because it was matted. And then with brushing my teeth, it sounds disgusting, but without assistance, I went days without being able to brush my teeth.
I need to ask you then, insofar as some relapses about the incidents. First, during that first week you were there, did you make it plain to the Johns Hopkins people around you that you wanted out of there? You wanted to be away from that place?
It was so obvious. I don't think you could mistake what I was saying for wanting to stay there. I wanted out, and I made that clear. I told everyone and anybody who walked in my room, whether it was the person delivering food, whether it was rec workers, nurses, doctors, anyone entering my room knew I wanted out.
What about the period where they had you in that room for 48 hours? Did you let people know, even during that 48 hours, whether you wanted to be in there or outside?
I did not want to be kept in a room all the time. I mean, even though I'm in a wheelchair and I can't walk, it doesn't mean I want to stay put. I'm still a kid. I want to explore and I want to do things.
Do you remember any incidents where you asked whether you could leave to go play with a kid or play in the rec room?
I never really asked to play with the kid because I knew their answer would be no. But I did ask to go to the rec room quite often.
Just because you were sitting there for 48 hours?
Yes.
Or 42, whatever it was. And then the event where on January 6th you were held and disrobed, did you let them know, Kathy Beatty and the other nurse there, know you wanted away from them and out of there?
Yes, I was crying my eyes out. I mean, again, you can't mistake that at all. There's no excuse.
Mm-hmm. And by the way, I don't know if I asked it on the other thing, but were you actually ever naked in front of them, either top or bottom or both?
Yes, so during the changing process, in the set of photos, you could see two different training bras. So I did change out of that, and Kathy did see me naked at times.
And how did that make you feel based on the way you just are about that?
Disgusting and violated.
Okay. Now, you said that your mom is always with you, and now we need to talk a little bit about your mom's death. And the first thing I want to ask is, you heard the rest of your family's testimony, but what are the things with her being gone that you really liked to do family-wise that you don't anymore?
Well, at least 3 times a week, my family found time to sit down and watch our favorite shows. Being from Chicago, it's kind of funny, but we watched Chicago Fire, Chicago Med, and Chicago PD. So every week, there was one day of the week where a new episode would come out, and that was just bonding time.
And what about hair and makeup?
Yeah, my mom, she did my hair and makeup for ice skating competitions. When I was in Illinois, I was on the competitive team, so that meant I got to travel. And I really cherish that because those were the only solo trips I ever got to go on with my mom.
So, are there certain phrases that your mom used that you either don't no longer use or I hate this word, but trigger you?
Yeah, there was a couple, and I mean, when I hear other people say them, I smile a little bit, but it hurts just because I wish it was coming from her mouth. And then Polish accents, it's just, they're so like comforting to me, but at the same time, like my mom sounded the same way.
And again, was this the first time you heard that your grandfather was part of Solidarity?
Yes, yeah.
How'd that make you feel in terms of wanting to go back and learn more about your family in Poland?
I definitely want to go back to Poland. I wish I could go with my mom, but...
So now, this was an important period in your life, I guess, from 10 to where you are now. If you had personal issues, a girl growing up, how did it affect you that you didn't have your mom around?
It was very hard because I think when young girls are going through those changes, it's even uncomfortable to talk to other girls about it because it's all new. So typically they talk to their mom, and I had YouTube, so that was it.
So, were you around other girls when they would talking to their moms about issues?
Yes, I had a lot of girlfriends, and it's hard because it's so beautiful seeing them have such a good relationship with their mom, but I get jealous.
I know. So now, with these conversations that you used to have with your mom, what happens when friends of yours, or just girls that you know from around, start having conversations about going shopping and things with their moms?
It makes me very emotional, but typically I'm very good at hiding my emotions. It sounds mean, but sometimes I get distant from them. Like I won't want to hang out with them as much anymore.
Perfectly normal. So now, are you still in the same bedroom you were in when your mom was there?
Yes.
And what about that, if anything, is that a dumb question, but how is that a problem?
It is a problem. I've changed my room so much. I've gotten a new bed, new sheets like I talked about. My dad has painted it a different color, and he's decorated it a little bit for me. But it's hard because I remember, the memories I do have of my mom, even though they're limited, I remember just laying in bed with her, and the nights when I was in pain, like screaming and crying, she obviously had work, but she would always get into bed with me and sit right next to me, try to calm me down. And she always had her laptop so she could do her work.
Just to be next to you. Now, while we're on that topic, I wanted to ask you about conversations with your mom while you were in the hospital at Johns Hopkins. And from the first that you went in, as time went on, what, if any, changes did you notice in your mom's voice and, if you will, approach to you?
Right. So I was granted phone call privileges with my mom at certain times, and I was very grateful for that. But you could just, when you know somebody, like you could hear when they're struggling.
Sorry.
What?
Water's good. So, during these periods of time, and I really want to go from the conversations when you first were in there, and then on as we get close to the time that your mom passed?
At first, the conversations were, I would say, pretty good. I wasn't allowed to talk about certain things, and she wasn't either. And you could kind of hear that in the audio recordings because she's either redirected or she pauses and has to rethink about what she's going to ask. And there's so many like little filler questions because even though we couldn't talk about important things, just being able to talk was enough for me. But as time went on, you could just tell like she couldn't think of any more things to talk about, and she was desperate to know how I was doing. And she probably heard too, like in my voice, that I was in pain and I was suffering. And it just got really difficult as we went on, and I could just tell she was falling apart.
Did it seem to you that her stress was increasing over this period of time?
Oh, for sure. Yeah, you could hear it in her tone.
Mm-hmm. And these stilted conversations, could you still tell, though? And if so, how could you, that she was getting more and more deeply into wherever she was going?
She does this thing like where she'll, in a way, like sigh talk.
Uh-huh.
And when she does that, it's out of desperation, or if she feels like out of control in a way, like she doesn't have control over the situation, what she could talk about. And depression, you could just tell she was just so hopeless.
What about, now you're a 10-year-old girl at this point. How did you have mixed feelings about even letting your mom know about what was happening to you?
Yeah, I did.
And why? Why would it bother you to tell her, to the extent you could tell her?
Well, obviously you don't want to worry your parent, and she's always been the one to take initiative with taking care of my health because that was her expertise. So you're telling somebody like, hey, I'm hurting, but you can't do anything about it. You're far away from me, first off, and you know that the hospital workers aren't doing anything about it.
Your Honor, respectfully, if we could.
In November, if you can recall back, were there calls where Kathy Beatty was interrupting you and your mom's calls?
Constantly.
How did that affect your ability to communicate with your mom and your mom with you?
Well, it made it very difficult. There were so many restrictions as is about what we could say and what we couldn't say, and then you have...
Your Honor, respectfully, same objection.
Overruled. He qualified it by a date.
And then there was a person sitting right next to me who's making funny faces and acting childish when I'm having this special time with my mom. I mean, Kathy, she could just talk to her mom whenever she wants. She could pick up the phone. But with me, I only got to talk to my mom when Kathy was present, and she made a fool of herself when I was on the phone with my mom.
There is testimony in the record about you being told that your mom was in a mental hospital during this period of time. Do you recall that?
I do.
As you sit here today, can you tell the jury how being told these things about your mom, especially now your mom is gone, how that affects you in everyday life?
So when I was in the hospital, I was told that she was in a mental institution, and that's one of the reasons I couldn't see her. So the first thing I'm thinking is, why in the world would she be in a mental institution? You know, she's not mentally ill, she doesn't have anything wrong with her, and she hasn't done anything to our family. So it really did not make sense. When I was allowed to visit with my dad, I asked him, and he looked at me like, what are you talking about? And that's when I started to realize most of the things that these doctors were telling me were false.
Does that, again, give you difficulty in certain situations trusting what someone is telling you?
All the time.
Suspicion, in other words.
Yes, I really don't trust people.
So now, on this, the post-traumatic aspect of things, we've testified before of certain places that bother you, but can you tell us a little bit more about just random things that bring back these feelings, these memories, these concerns?
Yeah, so I mean, the most obvious one is St. Pete. And I didn't always, not like going to St. Pete. I actually went there with my mom quite a bit when I was staying at the Ronald McDonald House for easier access to get to my infusion center. My mom and I would go downtown St. Pete, and she would wheel me around. And there was this one gelato spot that we always went to, Pachugo Gelato. She always got coffee, that was her favorite, and we would just sit and have a good time. Even though I was hurting, we still found time together and to make good memories. And now the fear of running into somebody at places in St. Pete is greater than the potential joy I may derive from revisiting those places that I used to spend time with my mom at.
I want to just mention some things. I don't want to take you back there, okay? So if this, I'm just going to, beeping noises.
Yeah, so beeping noises are kind of like all around us. So when, you don't buckle your seatbelt, the little beeping noise goes off. Or if I'm backing up my car, the beeping noise. When I was at school, when I was going to school physically, the alarm in between periods. But those prolonged, rhythmic beeping noises really bother me because in a hospital, that's all you hear 24/7. So in a way, the whole entire world in which, I walk in, there's always going to be reminders, and it's hard because, right now I could walk outside and I could point out 15 things that remind me of what I went through.
What about ticking of a clock?
Oh my gosh. When I was in the PICU, that's all I looked at was the clock. It was right at, a little bit above eye level. And that's all I did was stare at that clock. And I was just waiting and begging, okay, this is what I did. So after it would reach 2:00, for example, I would say just one more hour, you could do it. Then 3, and I just thought that eventually I would reach an hour where they would tell me I could go home, but it didn't happen for 3.5 months after that.
And because you were 10, you really didn't have the emotional development yet to deal with this?
Correct.
What about people in scrubs? I have random notes here, so I'm going to just say things.
Yeah, so, people, work in hospitals, doctors' offices, whatever. And after work, they might go to the grocery store, or they might walk their dog, or they might go to, Sephora or the mall. And whenever I see people in scrubs, I'm afraid of you. I will not go near you. I don't know. I just can't do it.
What about, maybe I covered this, public bathrooms, trying to...
Yes, so this is a more awkward thing to talk about, but when I was staying at JHatch, they would always have the door open whenever I was using the restroom. So I have a hard time in public bathrooms knowing that somebody may be waiting for a stall, or if someone is in the stall next to me, I get really nervous because it just reminds me of the nurses who were watching me urinate and use the restroom.
So then, what about just everywhere? Is there anywhere you feel,
It could be any.
Maya?
No, and not even my own home. And for a lot of people, that's where they go to relax. And it's not anything that, within the home. It's just the fact that we've lived through so much. And during that time, we were staying at the house we are still in.
Are you voting to move or not move?
Oh, move. Yes, I would love to move.
All right. So this takes us now to future plans. And back when we first talked, we talked a little bit about college, right?
Yes.
And we talked about some places you might want to go. At my school. How have your plans changed, if they haven't? I mean, you talked about going to school in New York, or what steps have you taken lately to actually make this happen as opposed to wanting to?
Well, again, the idea of college sounds really great. I mean, I'm a senior in high school, so everyone's asking me, like, where do you want to go? What do you want to do?
Have you submitted any applications yet?
Not a single one, and some of the deadlines are passed, and I really don't care, if I'm being honest. It's not that I don't want to go to school, it's just kind of like, what's the point? I feel like this chapter of my life needs to be resolved before I could actually take a step forward in moving on. In a lot of ways, I still feel trapped in, my 10 and 11-year-old body, because that's where my headspace has been living for the last 6.5 years.
Well, given your obvious performance now, the schools you're looking at, they're going to be academically challenging?
I would like to think so.
All right. Well, how do you think you're going to do in those environments with really cutthroat academic pressure and competition?
I think it's going to be really challenging. The first time I was ever alone from my family was at Johns Hopkins All Children's Hospital, and I'm a little bit afraid that when I'm alone again for a prolonged period of time, that I'll just feel the same way I did when I was 10 or 11.
Sure. And then, am I a difficult topic, but do you have any survivor guilt?
Yes, it's something that is also really difficult to talk about, but I was one of the last people to talk with my mom. And after finding out about her death, the next thing I thought of was, well, maybe if I said something different, or...
How did it relate to, like, do you retrace your steps and your conversations those last few days?
All the time.
And what concerns do you have about things you might have said or not said?
Well, there's a lot of, again, topics off limits, so it was kind of hard to have, like, emotional and personal conversations with her.
Sure.
In a way, it felt scripted, so I just feel like maybe she thought I didn't care or such, like, with talking with her, but those moments were so special to me.
Do you ever challenge yourself about whether telling her about how you felt and what was happening in there was not the right thing to do for you?
Yes, I feel like if I would have let her think that I was doing okay, that maybe she wouldn't have taken the step to end her life to get me out of there.
Right. And now, looking back on it, does it worry you that you told her those things?
Yes, I feel like it's my fault.
Okay. Now, I want to move on to loss of capacity to enjoy life. And you're doing great. You're doing great, Water. Let's talk about making new friends. We don't have that much more to go.
Yeah.
Let's talk about making new friends. How is that going? I mean, you have met a guy you like, and that's going well, I hope?
Yes.
Okay, good. How about other new friends?
Well, I recently made a new friend, and thankfully she's very understanding of my situation, but it's hard because I'll make plans with people,
and I'll really want to go,
Sure.
but then like last minute I'll cancel either because I'm in pain or my depression's too bad.
You don't want to see people. And does that happen at the last minute, like you said?
Yeah, and that's why I feel even more guilty, is because they probably just think, oh, she doesn't want to hang out with me, but it's not true. I'm just really struggling.
Sure. And then how about connecting with the older friends, the friends you already had?
Yeah, I don't talk to any of the kids from elementary school as much other than Riley.
Any particular reason why? Like going back even to your middle school days?
I think it's just hard because when you see the faces of people that were present and like during that time, it's already a reminder.
All right. And so when was the last time you actually were in a classroom type going to school?
2 years ago.
Why'd you stop? I mean, usually junior and senior year are pretty fun.
Yeah, I saw it for a lot of reasons. So I told you about the clock. Every single classroom has one of those. So when it's quiet, you hear the ticking and then I can't focus. And then the bells, it reminds me of John Hopkins. I was worried that the administrators I was just scared that they knew about what happened. I was scared that I may be taken away because my brother, when this was all going down, he got taken out of class and was examined alone. And I was terrified that would happen, so much so I actually started carrying my lawyer's card in my school backpack.
I'm still there. So the things that you were doing and very active in before, I'm going to go through them. You tell the jury whether you still do them or don't do them, and if so, how much. Piano.
I do not do that at all anymore.
Singing.
No, I do
Great
not
voice.
do that anymore.
Developing the Polish language.
No.
Can you communicate anymore with like your aunt here that
Barely, because thank God she knows some English, enough where I could actually understand what she's saying. But with my grandma, for example, my babcia, I cannot have a conversation with her. And it's so hard because on the phone when I call her, she'll just break down and she's just crying.
she's used to you being able to talk to her? Mm-hmm. Skating.
Nope.
I guess not. You never got back into gymnastics.
No,
because
I
of the
didn't.
CRPS.
Yeah.
That would be really dumb. Any other activities that you used to take great pleasure in that you no longer care about?
Yes, so in middle school, I was president of a ton of clubs, or I was an active member in a bunch of clubs. And I feel like people are like, that's kind of weird, like your mom just died, why are you doing all this? But I was genuinely just trying to distract myself, and school for me was my only outlet. But when I got into high school, my depression was just getting worse and worse. So I actually just stopped going to clubs, and I haven't been a member of a club in quite some time.
Mm-hmm. What about, did you do some public speaking then in front of the class before?
I have, yes. I was, for like the middle school graduation, I was one of the spokespeople.
And how come you're not doing that kind of socializing? I know another dumb question. Why aren't you doing that socializing and leadership role anymore?
Well, I just feel like I don't really connect with my peers anymore. It's really difficult for me to make friends, let alone keep friendships. And I realize, I am the problem. It's because I suffer from a lot of things, and I hope to get help for those in the future.
Sure. Understanding. Your relationship with strike that. What about your future insofar as being a wife or a mother?
Yeah, so, I mean, obviously I'm afraid for being even in a relationship because I have really bad depression and all I do is cry every day. It's guaranteed at least once I'll cry. And when you're hanging around a person that you're dating, you see them a lot. So at first I was able to kind of hold it, but now every day I cry in front of him. And I don't want him to think I'm crazy like other people in the past have thought. And then I'm scared with my CRPS, with the flares, because it's like taking care of a baby, you know? Like you lose a lot of abilities. And I don't want to give that life to somebody where they have to take care of me. And then with children, I don't have my mom, so I don't really have a girl to stand by my side and walk me through it. And
Wedding you're talking about?
weddings as well, yes. But yeah, pregnancies, weddings, and I'm quite fearful that in the future, if I do have children, that my fear of doctors will prevent them from getting care.
Okay. I had one more question on that, but I think I'll move on. So let's turn to the final area now. This is about things, what's known as the loss of child consortium with your mom. That's things that she used to do for you, with you, that now either you have to do yourself or have to get somebody else to do. So I have a bit of a list in terms of clothes shopping. Was that a big thing that she helped you with?
Yeah, Kyle and I both.
And then social advice.
Yes.
And physical comforting, snuggling, things like that.
Absolutely.
And then, of course, advice about growing up, becoming a woman, right?
Yes.
And then if you got sick or you thought you were getting sick, having a nurse as a mom.
Right.
Is that
Yes.
okay? Plus now you don't want to go to a doctor.
Yeah.
All right. Doing your hair.
Right. She always did it for me.
And of course, if you did decide to go somewhere, I guess she did split the chauffeuring around with your dad.
Yes.
Cooking.
Yes, she always cooked.
And the house pretty much stays spotless, don't it? Still?
Yes, still.
Right. Do you feel like you need to take care of your dad some now?
In some ways, I try to do the laundry as much as I can. I try to help out with our little dog. And I try to help out with Kyle sometimes in terms of driving him and whatnot. And I don't really buy clothes unless if it's with my money. That's why I kind of got a job. Obviously, he still buys me things and whatnot, but I do feel guilty because, you know, he's the only one bringing money. So I don't want to use it.
All right. Tell the jury any other practical things they should consider in terms of things that your mom did for you or did with you to the point where it was, you know, you won't do them anymore.
I think the other thing is just travel, you know.
But you have been out of the city
Yes.
a couple times. Good. Hopefully do more, right?
Yes, hopefully.
Okay. So before this, did I ask you to assist the jury in giving them some ideas, some quantitative data, if you will, on time that this affects you?
Yes, you did.
All right. So physical, emotional pain and suffering. How many hours on a single good day? If you have a good day, how many hours do one or more? Does this affect you? The aggravation of your CRPS and the PTSD and depression.
I would say about 12.
Okay. And then on a single bad day, including sleep time.
15.
Okay. And then mental anguish and what we talked about, all those things. On a good day, how many hours does it affect you?
I would say like around 10.
And then on a bad day, how does this, what we discussed, affect you?
18.
So 3/4 of the day.
Yes, I don't really sleep much.
Okay. Loss of capacity to enjoy life. How many hours on a good day?
11, 12.
Okay. And then what about on the bad days?
That would be again around like 17, 18.
Okay. Now, if we could kind of combine these together to the good days versus bad days in the week. And I know it's mixed, but can you give us an idea of how many days out of the week are good days and how many days are bad days?
I would say it really does depend on the season. I mean, right now it's actually a little bit harder than usual because October is the month that I was taken. But I usually do have more bad days than good. I would probably say 5 out of the 7 days are bad.
All right. And that's taking into account the 3 categories for that.
Correct.
All right. And then about the effects of the loss of your mom. Let's talk about how many hours on a single good day that this substantially affects you. And I'm not talking about just a passing thought. I'm talking about whether, it's substantially affecting your life.
Right. I would say about 7 hours.
Okay. And I had you think about this before.
Correct.
All right. And how about on a single bad day?
That would be like 9, 10.
Okay. All right. So then how many days out of the week are good versus bad on average?
I mean, I think about her a lot, and her death has severely, impacted me, and I would argue that that's probably like 6 out of the 7.
Okay. So 6 bad to 2 good.
1 good.
And finally, Maya, are you worried about the future at all with the challenges that life brings? Relationships, jobs, things like that?
Yes, I mean, the first job I had, I held for a week. And then the next one, just over, a couple of months. So I obviously don't really know how to hold a job without it either triggering my PTSD, depression, or CRPS. And then I am worried with my relationships, as I said, with friends and even my boyfriend.
Okay. All right. Nick? Anything else? Thank you, Maya.